Assalamualaikum everyone. Hello dan selamat pagi. Did I say it correctly? I hope so. Thank you for having me this morning.
Yeah, okay, Professor, you can start your lecture. Okay. Hello, Professor Hiba.
Yes.
Yeah, you can continue your lecture.
Okay.
Yeah. Wait, please wait the minute because I have to introduce you first to the participant. Please allow me to briefly your curriculum vitae. Okay.
Sounds good.
Ladies and gentlemen, this morning we are greatly honored by join the one of our distinguished plenary speaker, Professor Hiba Weber, Alamah PhD, RN, FNPBC, CTNA, FTN, SS, FAAN, who will deliver her presentation live from the United States through the Zoom platform. Allow me to briefly introduce our honorable speaker. Prof. Hiba curriculum is truly outstanding and very extensive. Please allow me to apologize if I am unable to mention all of her remarkable achievement in detail due to time limitation. Professor Hiba Weber Alamah is a distinguished professor at the University of Michigan Flint School of Nursing, USA. She earned her PhD and postmaster certificate in transcultural nursing from Duquesne University and complete additional fellowship at Yale School of Management and the Harvard Graduate School of Education. She is fellow of both the Transcultural Nursing Scholars and the American Academy of Nursing and is globally recognized for her outstanding contribution to transcultural nursing education, research, and practice. Professor Hiba has received numerous prestigious awards, including the Michigan Distinguished Professor of the Year Award, the Madeleine Leninger Award from the Transcultural Nursing Society, and the Distinguished Diversity Leaders Award from the University of Michigan. She has also co-authored several foundation textbooks in transcultural nursing, including Leninger's Transcultural Nursing Concept, Theories, Research and Practice, and Culture, Care, Diversity, and University. Her scholarly work continues to advance the understanding of the cultural, competence, diversity, and sustainability in global healthcare practice. Today, Professor Hiba will share her insight on very timely and essential topic addressing global challenges through sustainable and culturally competent healthcare. This presentation will inspire us to think critically about how nursing can continue to play a transformative role in achieving equitable, inclusive, and sustainable healthcare across culture and nation. Before we begin, I would like to kindly remind all participants that Professor Hiba has prepared a public version of her presentation slide, which will be made available after this session. However, during the live presentation, please refrain from taking any photo, screenshot, or sharing slide, as the material is protected by copyright. We sincerely appreciate your understanding and respect the speaker's intellectual property. So, without further ado, please join me in welcoming Professor Hiba. Professor Hiba, floor is yours.
Thank you. I'm sorry that I went before your introduction. I was eager to practice saying hello dan selamat pagi. Hopefully I said it correctly. I would have loved to be with you in person. Unfortunately, I was not able to, but I'm glad that we can do it via Zoom. And I always like to acknowledge members of the audience before we start. So I can see the members who are currently sitting around those beautiful red tables. So I would like to ask if we have any nursing students in the audience, if you can stand up so we can all see you and recognize that you actually came to attend this conference and further your learning. So do we have any nursing students in the conference? If you are here, please stand up and be recognized.
Please stand up. Nursing student, please stand up.
Yes, please stand up and let's give them a round of applause. And if you're online, you can raise your hand online. Great, and please have a seat. If we have any nursing faculty, can you please stand up and be recognized? And if you are on Zoom, raise your hand.
Okay.
And let's give them a round of applause for all the faculty who are with us today. And finally, if we have practicing nurses, you're our workforce. So please also stand up and be recognized.
Practitioner.
And thank you for all that you do. Okay, great. Right. So thank you all for coming today. I know it's early morning for you. For me, it's 9:30 p.m. This is actually my 7th presentation for the day. So the reason I have this material copyrighted is you actually are going to get first glimpse of a new model that I'm working on that's actually not published yet. And also, two of them are going to be shared in this presentation.
Recording in progress.
2 of them that have not yet been published anywhere. So you're really getting a first glimpse. And also one that's in press right now, but not out. Today, it is my hope to discuss with you Dr. Madeleine Leininger's work and global legacy. I know some of you have already worked with her theory and ethnonursing research method, but it is essential that we learn about her work because the past defines the present, and the present really informs our future. So we cannot ignore the work of Dr. Madeleine Leininger in establishing the field of transcultural nursing and transcultural healthcare that exists today. Next, we're going to explore national and global challenges that we are currently facing and will continue to face, not just as nurses, but also other healthcare providers are facing as well, in clinical practice, as well as academia and research. And finally, we're going to go over existing and some suggested national, global, and educational strategies and initiatives that we can all engage in on a personal and collective level to promote collaborative and transformational culturally congruent care. So as I said, the past has to inform the present and the present informs the future. So we're going to start with a brief review of Dr. Madeleine Leininger's work. Dr. Leininger is a world-renowned nursing theorist. Unfortunately, she passed in 2012, but for six decades, she actually was an international author, presenter, prolific in the number of publications and presentations. It is actually it is thought that she has contributed to more than 30 books in different languages. We know that she has published more than 300 articles and more than 60 book chapters and hundreds, if not thousands, of presentations around the globe. So she's also worked as a consultant and went around the world and shared her knowledge at the national and global level. She was born in Nebraska in 1925 on a farm, and it is in Nebraska that she also passed away. I was very fortunate to be able to visit with her literally, I think, a couple of months before she passed away. And while I was visiting with her, we did some video recordings where she shared with us stories about how she developed the cultural care theory and the ethnonursing research method. And she also recorded messages for future learner of the theory. So this is, I feel, is a treasure that I was able to obtain before she passed away, and I use it in the courses that I teach. So it's a quite nice message from her. Her father was of German descent and her mother was Irish, and you can see that she grew in a blend of cultures, and I think that could be the starting point that helped her realize that cultures are important, and it's important to learn about them and understand them and learn how to accommodate and provide for them. She pursued a PhD in social and cultural anthropology at the University of Washington, and I will share with you what led her to pursue this degree. In the 1950s, she was an RN working in a child guidance center, which is equivalent to a pediatric mental health unit today. And while she was working there, she noticed that she had patients or children from different cultural backgrounds. And yet the nurses and physicians were trying to apply a one size fits all type of treatment. And that approach did not sit well with the parents who felt that the cultural expectations and needs were not being met. There were different cultural expectations based on the cultural background of the patients, but the nurses were just using a standardized approach, which obviously did not work for those patients. They were frustrated, they were upset. And so she consulted with Dr. Margaret Mead, who encouraged her to pursue the education and knowledge and to develop her own scholarly approach for culturally congruent care and cultural competence. So that is when she decided to pursue her education, and she started her PhD. And it was while she was doing her PhD that she went to New Guinea, and she stayed with the Gatsub Akuna, and she actually went there on numerous occasions. You can notice that these pictures are, with the same people, but they're taken on two different times. She's older in the top picture, she's younger in the lower picture. And that's because she continued to travel and visit with the people. And it was during her first trip that she laid the grassroots for the culture, care, diversity, and universality theory and the ethnonursing research method. And when you hear the stories that she shares about some of the terms that she developed, for example, gatekeeper, one of the stories she shares is that when she arrived at the village, there was a fence and there was a chief behind the fence. And the chief had to ask her, what are you here for? Why did you come? He was the gatekeeper. That was one of the terms that she coined based on her personal experience. So that's what, her experience with the people in Gatsub Akuna of New Guinea helped her share some of the language that she developed for the culture care theory. By the way, the culture care theory is the abridged name of the culture care diversity and universality theory. So again, that's where it started while she was a student in her PhD program. So we do have students with us today. Who knows? Maybe one of you can become a theorist, a world-renowned theorist in the future. Don't underestimate your work. That's how Dr. Leininger started, and look where she ended. So in the 70s, largely due to her intensive work in the field, transcultural nursing as a discipline began to be professionally accepted. And it was very difficult when she started this work because cultural care was not viewed as scientific. There was a lot of resistance to the terms culturally competent care or culturally congruent care. There was initial resistance, but she persevered and eventually she developed the field. And in the 1974, 1975, she came up with the idea of starting a society. And she, along with a group of her own students who later became educators and scholars in their own rights, developed the Transcultural Nursing Society. And she was the founder and she worked tirelessly in the society until the day she passed. In 1978 is when she published her very first book, Transcultural Nursing Concepts, Theories, and Practices. There are numerous editions of this book now, but the very first edition was published in 1978. So if you can lay your hand on an original copy, that's quite a rare find. In 1985, she published the Yellow Book, Qualitative Research Methods. And this book is extremely important because it includes the very first version of the ethno-nursing research method. Now, one thing to keep in mind, while she began the development process in the 60s. It took her 6 decades to evolve her work. And even after she passed away, she charged Dr. McFarland and I with the continuation of her work. So the theory and the ethnonursing research method continued to evolve even after her passing. In 91, she published the very first edition of the culture care theory book. That's the bubble book. We commonly refer to it as the bubble book. And in 1991, that's when she established the Journal of Transcultural Nursing, which is an extremely important journal. This is an important resource for students and individuals who are interested in getting the most up-to-date evidence base related to transcultural care. So again, it started in 1991. And by the way, she was the first editor of the journal, remained as first editor for numerous years. And then Dr. Marilyn McFarland took over. And now we have different people. In 95, the second edition of Transcultural Nursing was published, followed by the third edition in 2002. And that's the orange and blue book that you can see. In 2006, you have the second edition of the culture care theory book, the one that has her picture with in New Guinea. And in 2012 is when she signed her work to us. And that's our picture with her. Dr. McFarland is the lady on the left side of the picture. Dr. Leininger is in the middle, and I'm on the right. And that was, this picture was actually taken in Florida, at Florida Atlantic University, which houses the archives of Dr. Leininger's work. So if you ever have the chance to come to the United States, if you have a chance to go to Florida Atlantic University, you must visit the archives that have all of her work. Since she passed, we have new editions of both books. The book on the far right, the orange with the sunrise, this is the 2015 third edition of the culture care theory book. And then in the middle, this is the most current edition of Leininger's Transcultural Nursing book. And the book in the yellow, in the white, this is a book that is the newest edition. It is actually coming out this month. So you are getting a sneak peek. You're the first people to actually see how the book looks like. And what is unique about this book is that we changed the focus from nursing only to multidisciplinary. Because societies evolve, even in nursing, we do value and promote interprofessional collaboration. So that was reflected in this edition of the book. And so the focus has changed to include all healthcare disciplines. And like I said, this book is, we're hoping it's going to come out by the end of this month, but definitely by the end of this year. And we're very excited about it. And Dr. Leininger's work, since we're talking about global outreach, has been translated into numerous languages, including Mandarin Chinese and Italian. And we've been approached with requests to translate her work to Spanish, and we're going to do that. And in 2011, I was invited to a university in Taipei, Taiwan, National Yang Ming University, to teach a transcultural nursing course. So I went there with Dr. McFarland, and we used the two versions of the book, the Mandarin Chinese and the English version. And the students were a mix of international students who used the English version and Taiwanese students who used the Mandarin Chinese version. So it's important that your work is disseminated in your native language as well as in languages that can be accessed globally. The major contributions of Dr. Leininger, besides establishing the field of transcultural nursing, are the theory of culture care diversity and universality and the ethnonursing research method. So I really wanted to take a couple of minutes to talk to you about her theory and her research method. So the culture care theory was truly ahead of its time. I mean, Dr. Leininger in the 50s began thinking about the universalities and the diversities. When we talk about universalities, we're talking about what we have in common, commonalities. What do we have in common? What's the glue that binds different cultures together? One simple example can be our love for family. Love for family is a universal across different cultures. Many cultures you will find that they emphasize taking care of loved ones. They emphasize the importance of family. On the other hand, there are diversities or differences that vary from culture to culture, and sometimes even within the same culture. Even within the same family unit, you can have commonalities and diversities. So Dr. Leininger recognized the importance of these two concepts fairly early on. And she wanted to develop a theory that would encourage everyone, whether you are a clinician, a researcher, or an educator, or an administrator. She wanted to encourage us or empower us with the means to be able to understand and discover and relate to the relationship between culture and care. And the ultimate goal would be the delivery of culturally congruent care. And we deliver culturally congruent care when we take into consideration that at the individual level or the family level, group level, organizational level, national level, global level, population level, we all need to understand each other and understand again the commonalities, the diversities. And it's not only when we're talking about illness, it's also when we're talking about health and well-being, even dying, facing disabilities. And we can do so through the application of our culture care theory, which is really done through the three care modes, which are called the care decisions and action modes. And I'm going to explain them to you in a couple of slides. But the ultimate goal of the theory is to expand the body of knowledge. The more we know, the more we are empowered to provide culturally congruent care. That is care that fits with the needs and beliefs of the people who are caring for. So this is the culture care theory. And you can see on the top, everything is in yellow. These are called the rays of the sun. So that's why it's yellow, because she labels them as the rays of the sun. These are the cultural and social structure dimensions, which are what colors our worldview, the way we view the world. So according to Dr. Leininger, and by the way, you can see on the left side of the screen how the theory evolved. You can see how it started. Look at the very top in black and white. And then later on, she developed it further. And then this version you are looking at in the center is the version that Dr. McFarlane and I evolved or developed after her passing. We changed the focus from simply nursing to integrative care. That means that we took into consideration not just the nurse, but the entire care team, and not just the medical model, but the humanistic model as well. Meaning, so a person's worldview or view of the world is colored by numerous dimensions and numerous factors. These include educational factors, economic factors, political and legal factors, biological factors, cultural values, beliefs, and lifeways, kinship and social factors, religious, spiritual, and philosophical factors, and technological factors. What does this mean in real life? It means when you're caring for a patient, you need to consider their educational background. You know, if you are caring for a nurse or a physician, the language you use is different than when you are caring for somebody who doesn't have a professional background, a healthcare background. If you don't go to your neighbor and you tell her, the doctor said, take this medication, BID. They will not understand what BID means. But if you're caring for a fellow nurse or a fellow physician, you can tell them, the recommendation is you take this BID, they will understand. Economic factor, you need to take into consideration the economic background of your patient, or it could be an organization, it could be a group of people. So and why is this important? Again, if they cannot afford the type of treatment you are recommending, you need to look for an alternative that they can afford. Political and legal factors. Look what is happening in the world today. How many refugees do we have around the world? How many migrants and immigrants do we have? What is going on in areas where you have a political conflict happening? All of these are important considerations that you need to consider as you are planning care for the people you have in mind. So looking at all these factors, and by the way, kinship, it's family. When you talk about kinship, what does family mean to you? How do you define family? Are you estranged from some family members? Some people do not get along with their family members. Some people do. Some people consider their pets part of their family. Some people consider their religious community to be part of their family. And some people are not religious. That's why when we revised the theory, we added spiritual, because some people do not consider themselves or do not identify with any specific religion, but they identify with a philosophy, or they feel that they are spiritual, even though they don't consider themselves to be religious. So again, we wanted to look at the whole spectrum. And then when you do this, you assessment. The theory comes with numerous enablers. One of them is called the semi-structured interview enabler. It's heavily used by researchers conducting ethno-nursing research studies, but it can also be used as a cultural assessment in the healthcare setting, even in the academic setting. So doing a cultural assessment, investigating all these different factors helps the nurse or other healthcare provider understand their patient and what genetic care practices they use. What are some home remedies common in your neck of the woods? What are some common home remedies in your country? If you know them, then you will account for them in your care plan. You will know that, oh, maybe they're using this, so I need to ask about it. Maybe there is a potential interaction between a home remedy and a medication you want to prescribe. So you end up working collaboratively with your patient. That's what we recommend, a collaboration, through an integration of what your client, your patient is using, their values, their beliefs, their practices, and your professional background, what you've learned academically in your formal education. And the outcome is the utilization of those three care modes, which are basically the thing you need to remember the most doing in your practice. So let's talk about the first one, cultural care, preservation, and or maintenance. When we're looking at this care mode, this cultural care mode, I need you to think about, what did you discover that your patient is doing that is good, that is healthy, that is going to make their health and well-being better? What do you want them to continue to do? What do you want them to preserve, to maintain? These are the decisions and actions that you want to promote. An example could be, your patient tells you they exercise every day. These are good practices. You want them to continue to do them. Maybe your patient will tell you, prayer or meditation gives me peace. This is great. You can encourage them to continue to do this. Maybe it's, you know what, I'm watching what I'm eating now. I stopped eating processed food. I'm eating fresh food, home cooked food. This is good. We want them to continue to do that. So these are actions and decisions that need to be preserved or maintained. The second category is what we call cultural care, accommodation, and or negotiation. When we're talking about accommodation, I need you to think about you as a provider, as an educator, as a manager, as a researcher. What do you need to do yourself? What do you need to change at what you normally do to meet the needs of your population, of your patient? What do you have to change yourself to accommodate the needs of the others? Okay, so one common example we use here in the United States, especially when we have some, a patient who's in their personal belief system, it's important to have a lot of visitors. We need to accommodate them. We open a private room for them so their family members can come and wait during surgery. So that's one example of accommodation. Another way we accommodate our patients, I'm going to give you another example that is common here in the United States. When we have a Muslim patient, the hospital, typically the first food after surgery is jello. Jello in the United States is not halal. So we can accommodate the need of our patient by talking to the kitchen, making sure they provide a vegan jello or a halal jello. That's one example of accommodation. Now, negotiation is what you will ask your patient to change in their behavior. So you're basically telling them, okay, how can we get to a middle ground? For example, a patient has high cholesterol levels and they love fried chicken. You negotiate with them that they will switch to grilled or baked chicken instead of fried chicken. Maybe a smoker, somebody who tells you I smoke a pack a day. You can negotiate that they slowly decrease the number of cigarettes that they are smoking. So that's what negotiation. So again, you need to keep these three care modes in mind. What are they doing that is healthy to preserve and maintain? How can you accommodate their needs? What do you need to negotiate? And finally, what is happening? What beliefs or practices your clients are using that are potentially harmful or deadly? What do you need to change? What do you need to repattern? What do you need to stop? What do you need to restructure? I will give you an example. We learned that in Lebanon, a common practice is to pour kerosene on children's hair who have head lice. Apparently, it works. It actually kills head lice. But can you think of a potential harmful ramification as a result of using kerosene on children's hair? What if somebody was smoking nearby? Think about the effect on their skin, their breathing. So there is potential harm happening. Therefore, you need to stop. You need to repattern. You need to restructure this practice. And typically, the repatterning and restructuring is done through the process of education about the harm that can happen and offering replacements, offering other ways of fulfilling the need without causing the harm. In the end, the decision is up to your patient. We can never force our patients to do anything. Our job is to educate, inform, empower, and work collaboratively with our patients. Another example can be sharing needles. That is harmful. We need to teach them about the harm and explain to them it's better to just, you can go to this place where you can get free needles instead of reusing the same needles or sharing them. Another example is smoking the hookah. Very popular these days among youth. And one hookah head, they say, is equivalent to either 60 or 100 cigarettes. So another example that needs to be repatterned or restructured. So I referred earlier to the ethno-nursing research method. And we do know that while she began the process of development in the 60s, the theory and the method, as I said, continued to evolve over 6 decades. So the last time we did the research, we found that in 2017, there were 361 ethno-nursing studies that were completed up to that point. Now, we just did the research again because we are publishing the new edition, and we found out that between 1966 and 2024, there were 611 publications of work within the framework of the culture care theory. But we noted not all of them were ethno-nursing research studies. And why is that? Because the way Dr. Langer designed is the theory can be used by itself. It can be used with any qualitative research method, but the ethno-nursing research method can only be used with the culture care theory. So I'm going to repeat. The culture care theory can be used with any qualitative research method. It can be used with an ethnography. It can be used with a longitudinal study. It can be used with a focus group. But the ethno-nursing research study can only be used with culture care theory. You cannot use an ethno-nursing research with a different theory. It has to be with the culture care theory. And what is unique about about the ethno-nursing research method is that it comes to you with a lot of enablers. It is based on doing interviews, just like in ethnographies. But those interviews that you're developing, the questions for the interviews are derived from the Sunrise enabler that I just showed you with the yellow top. And she even provides you, and this has been revised, we literally recently revised the questions that you can ask to make them more inclusive of the new revision of the theory. And so now you have a set of questions that all you have to do is look at and adapt to your research study. That's why doctoral students who choose to do the ethno-nursing research method, they have the easiest, I want to say the easiest run when it comes to completing their research, because everything is provided for you. You just have to follow the steps. You already know how you're going to develop the questions, how you're going to conduct the study, how you're going to do the data analysis, and how you're going to present your information. It is a very clear process that doctoral students appreciate. So I want to talk now about her contributions in education, in academia, and in research. Remember, she was a prolific writer. She was a presenter that probably presented, I want to say, hundreds, if not thousands of presentations during the course of her lifespan. But she started in academia as an associate professor at the University of Colorado. And while she was there, she mentored Dr. Marilyn Ray. We call her, she likes to be referred to as D. Ray. So she pretty much, her nickname is D. So we call her D. Ray, Dr. Marilyn D. Ray. And this is significant because, as I want to share with you today, is that the students she mentored became transcultural scholars, transcultural fellows, and theorists of their own. So, D. Ray was mentored by Dr. Leininger while she was in her MSN program. When Dr. Leininger moved to Utah, she mentored Dr. D. Ray again in her doctoral studies. So twice, Dr. D. Ray was mentored by Dr. Leininger professionally. But look what happened when Dr. Leininger moved to the University of Washington. In the University of Washington, her role was not only a professor, but a dean. So she was the dean of the School of Nursing. She was also a professor. In both of these roles, she established a PhD program in nursing, and she was the director of that program. And she also established a program of transcultural nursing and human care study. And she was the director of that program. So under her leadership, that's what she did. She started to create those programs and those degrees that prepared students in the topic, in the field. And that's how we ended up having transcultural nursing as a world recognized field today, through all of her efforts in academia and in her scholarship. At the University of Utah, she also was a dean and professor. While she was there, she developed the first master's and doctoral programs in transcultural nursing. And she was the director of the Center of Nursing Research. And guess what type of research she encouraged? Ethno-nursing research. And she also developed a PhD program and a transcultural nursing program at the University of Utah. And by the way, Dr. Beverly Horn, whom she mentored when she was in the University of Washington, is the first person to actually complete an entire ethno-nursing research study. And at the time, she did it with the Muckleshoot people, which is a Native American group. And she did that also in Washington. Her last academic role was at Wayne State University in Michigan, like an hour away from where I live. She was a professor at that university, but she also was the director of the Center of Health Research. Again, pushed for ethno-nursing research. She also was the director of the transcultural nursing program that she established. So you can see her role in spreading and developing this field. And while she was there, she mentored Dr. Marilyn McFarland, who later on took over her work with myself, and Dr. Rick Zuha in the middle, and Dr. Edie Morris. Dr. Edie Morris was actually the last student of Dr. Leininger. All these people that I've shared with you today are recognized transcultural nursing scholars and fellows. And many of us, like DeRay and Marilyn and myself, have our own books, and many more, and that I will share with you very shortly. So was it all roses? It was not. She pushed people's buttons. She challenged people. Many people loved her. Many people could not stand her. That's what happens when you're a theorist. Some people will agree with you. Some people will not. But she was a force to be reckoned with. She was amazing. I don't know if any of you in the audience have had the opportunity to actually see her face to face, see her speak, or watched a video where she actually delivered a presentation. But she was amazing. My recollection of her, whenever I would run into her at a Transcultural Nursing Society, she was so active. She would literally like stand on top of a table and she would talk and she would dance, and people were like in awe of her. But she inspired people, she influenced others, but most importantly, she challenged many nurses to develop their own theories and their own models and their own approaches to transcultural healthcare. Some of these people include Dr. Larry Purnell. And I don't know if you have read his books. If you are familiar with his work, if you can raise your hand, I can see you. But Dr. Larry Purnell, who retired now, is also world renowned for his Purnell model for cultural competence. This model is heavily used in hospitals. It's been translated to numerous languages that you can see on this slide. I'm not gonna read them, but obviously numerous languages. And his books also are very commonly, like I said, used in academia, but in healthcare. And most importantly, transcultural healthcare, a culturally competent approach, and the guide for culturally competent healthcare. Very nice books because they focus on specific cultural groups. Dr. Josefa Campina, she has developed numerous models, including the process of cultural compatibility in the delivery of healthcare services, and a biblically based model of cultural competence in the delivery of healthcare. She also has numerous tools that are available on her website. One thing I want to caution you about, whenever you are referring to Dr. Josefa Campina Bakoti's work, all of her work is copyrighted. You cannot use any picture of her model, nothing without written permission from her. Otherwise, you are going to get a big bill. So her work is excellent, but refer to her website directly or purchase her book or obtain her written permission. One thing that you need to know about her is she is extremely talented, and I have many times observed her playing the flute at nursing conferences. Dr. Marianne Jeffries is also known for her cultural competence and confidence model. She has a teaching and cultural competence in nursing and healthcare book, and she has numerous questionnaires that have been used in a lot of studies that we use today as evidence-based that cultural competence is an ongoing process, and that it does actually yield positive results. Numerous tools developed by her that I have listed here. Again, if you look her up online, all this stuff is available online, and you can even order her book online. Doctors Margaret Andrews, the lady in red, and Dr. Joycine Boyle, the lady in blue on top, are known for their transcultural concept in nursing care book. The last edition, which was published last year, was co-authored with Dr. Patty Ludwig-Beamer and Dr. John Collins. And now Dr. Andrews has retired, so her name is the last name in the book. But Dr. Andrews and Dr. Boyle have to together develop numerous assessment tools that are included in their book. And I've listed them here for your benefit. And they are actually quite famous for their work. This is Dr. Joyce Newman Geiger on the left with the curly hair. And on the right, you have Dr. Ruth Elaine David Heiser. They developed the original Transcultural Nursing Assessment and Intervention book and the original Geiger and David Heiser Transcultural Assessment Model. Dr. David Heiser passed away. I actually did interview her husband, and we did a very nice presentation when she passed away. One thing I learned about her is she used to actually pay for the tuition of the students that could not afford to pay their tuition out of her own pocket. And she used to grade while driving, which is not a good thing to do. And she actually ended up in several car accidents because she would grade while driving. But she had a heart of gold, as evidenced by the fact that she would pay her students' tuition out of her own pocket. And it was a great loss when she passed away. The newest edition of the book is authored by Dr. Geiger and Dr. Powell Young in the green. If you're familiar with the European Transcultural Nursing Society, you must be familiar with the work of Dr. Irena Papadopoulos. She has numerous books that I have listed here for you, and some of them have been translated to Greek. And Dr. Rachel Spector, also retired. Many of these people have retired, but their books live on, their theories live on. She developed the health traditions model, and her book is Cultural Diversity in Health and Illness. She is no longer publishing new editions of her book, but her most recent editions still exist. Finally, actually not finally, Dr. Sandra Lovering, she worked for years in Saudi Arabia. And while she was working in Saudi Arabia, she developed the Crescent of Care, a nursing model to guide the care of Arab Muslim patients. She is currently retired in New Zealand, and she continues to work as a consultant. Dr. Priscilla Sagar, she is the author of Transcultural Nursing Theory and Models, and she also authored Transcultural Nursing Education Strategies. And the reason I'm sharing all these resources with you, because these are important resources to have in your library, and you can decide which book meets the needs that you currently have. But these are excellent resources to have. Dr. Joanna Maxwell Basseray authored Culture and Health, Concept and Practice. And here we go, Dr. Marilyn D. Ray. She is extremely active in Japan. She actually travels every year to that conference, and she presents about her theory of her model of transcultural caring. She also authored the theory of bureaucratic caring, which is very helpful to nurse administrators. And you can see her book in the picture, Transcultural Caring Dynamics in Nursing and Healthcare. Dr. Marilyn Duckers and Dr. Dula Pacquiao are the co-authored the Core Curriculum in Transcultural Nursing book. This is such an important book. It's really like the core curriculum for transcultural healthcare. It was published in 2010, so we need a newer edition right now. By the way, at the Transcultural Nursing Society, a group of us, scholar fellows, are working together to develop a cultural competence toolkit. So some of the stuff is going to be uploaded in a newer format in the coming month. And And they also published a book with Dr. Larry Purnell, Guidelines and Practice for Global Applications of Culturally Competent Healthcare, quite fitting for this conference theme. This is Beth Lincoln. She is a member of the Transcultural Nursing Society. She is not a scholar nor a fellow, but she is a member of the society, and her books truly bring the human perspective, the nice stories you want to share with your students in the classroom setting. And she is a past president of the Transcultural Nursing Society. Dr. Carol Holt developed a book titled Global Healthcare Issues and Policies, also very fitting for the theme of this conference. And last but not least, Dr. McFarland and myself, who co-authored the books, both newer editions of Dr. Leininger's books. And as I said, anytime now, we're expecting the newest edition to come out. We have traveled the globe together. We often present together. In fact, in 2 weeks, we're traveling to TCNS to present again together. So now that we're done with the past, it's time to look at the present. What is happening today around the world that is impacting transcultural healthcare? So first of all, there are numerous terms that you will see being used related to the topic, related to promotion of cultural care. And if you even look each term, you can find numerous definitions for each one of these terms. Is there anything wrong with having numerous definitions? No. All you need to do is you need to look at the available definitions and choose the one that appeals most to you. And that's the one you will use. And regardless of which definition you end up adopting, I'm sharing with you in this slide and the next some of the definitions that appeal to me, some that I even developed with Dr. McFarland. But the important thing is to note the similarities, the overlap, as well as the differences. So they're not all the same, even though sometimes we feel that the end result might be the same. So when we're talking about culturally congruent care, the focus is the recipient of care. The focus is the person to whom you're providing the care. When we're talking about cultural competence, the focus is yourself as a nurse, as a provider. You are on a quest to become more culturally competent. But in the end, the outcome, the goal, is that the person you're caring for receives care that they deserve, that makes sense to them. When we're talking about cultural humility, we're talking about how you need to engage in self-assessment, and and you need to appreciate the differences and the values and the commonalities that your patient have. And it is also an ongoing process, just like cultural competence. When we talk about cultural compassion, and this is a concept that you will hear Dr. Papadopoulos talking a lot about, it refers to your ability to be empathetic, to understand what the person you're caring for is experiencing, what is important to them, and appreciate it and take it into consideration and respect it and try to incorporate it. So you can see the similarities with the unique nuances, the unique differences. And when we talk about cultural safety is a concept that was originally coined in New Zealand through the Nursing Council of New Zealand. And again, it involves a process on your own cultural identity. So there is an element of self-assessment, but also there is an element of you understand the impact it can have on the others. So again, lots of commonalities between the different concepts. Regardless of which concept you decide to adhere to, the end result is the same, providing culturally congruent care. So why are we even doing this? Why are you even here today? Why are we doing this conference? To investigate what is important and how can we engage and provide culturally congruent care. Why is this important to you? I needed to really reflect on this. Why is this an important topic today? What is happening around the world that makes it important today more than ever before? You can see that through the use of Zoom, I was able to join you in your area, across the world. So the geographical barriers are slowly being erased. And we also have a lot of migration, a lot of travel. You have tourists in your area that come and they might get sick and you may have to take care of them. So providing culturally congruent care has many benefits. For one, your patient will feel respected. They will feel that you actually took the time to learn about them, to learn about what is important to them, and that you are trying your best to provide them with care that fits with their belief. And when they notice this, they are more likely to trust you. They are more likely to be happy with the outcome, to be satisfied. And when they are happy, they are more likely to come again, to see you again. And the fact that they will be able to trust you, they are more likely to follow up on your recommendations. So if you tell them, this is what we recommend that you do, they are more likely to actually listen to you and take into consideration your recommendation and apply them. And doing so will also enhance the recovery process. Whereas if they didn't trust you, which is the other side of the coin, if you're delivering care that they feel does not meet their own beliefs and practices, they feel disrespected, they do not trust you, then, if they don't trust you, they are probably not going to come back. They're going to be unhappy, and they're not going to try to follow your directions as far as a plan of care, because they feel you never really heard them. It's important that we listen to them, that we acknowledge their beliefs, their feelings, their practices, their traditions. And if you don't do that, they're not going to trust you, they're not going to come back, and therefore it's going to take longer for them to heal and recover. And these are things we need to avoid. Today, we have many also resources that are available for us to help us with the process. Many professional organizations have developed their own codes, guidelines, criteria, position statements related to cultural competence or culturally congruent care. And I need you to think about local organizations, local nursing organizations within your own country, within your own neighborhoods, within your own institutions, hospitals, or universities. What is existing out there? What do you have that relates to your students or your patients? The importance you place on culturally congruent care, on providing them with care that fits with their religious beliefs or cultural beliefs. So the Transcultural Nursing Society in 2017 released a position statement on human rights. I'm actually only going to share with you two resources, but there are tons of them. And as I shared with you earlier, we're currently working on a cultural competence toolkit that we're going to publish on the website of the Transcultural Nursing Society. One of them has a ton of resources for nursing and other healthcare disciplines as well. Hopefully it will become available before the end of this year. But anyways, the Transcultural Nursing Society in 2017 issued their position statement on human rights, and in it they stated, it does not matter what race you have, what ethnicity you belong to, what is your national origin, what religion you abide by, your philosophical beliefs or gender, sexual orientation, does not matter what cultural values you have. Everybody have the following universal human rights. One, access to quality care. What makes quality care? Culturally congruent care makes quality care. Second, access to culturally and linguistically providers. I'm sure you have some means of caring for people who do not speak the local language, the native language. If I was to come and be a patient, I do not speak your native tongue. I had to use a translator to figure out how to tell you good morning, hello, and good morning. I don't know how to speak your language. Many of the nurses might speak English, but what if you had a patient that you didn't speak their language? What mechanism do you have to communicate with that patient? You have something in your hospitals. Again, figure it out and teach your students about it, about how to use the best possible approach to be able to communicate with your patients who do not share your native language in a way that still is culturally sensitive. Respectful care. They have numerous bullets that I highlighted here for you today. One thing they highlighted is that the patient has the right to accept or refuse care. They have the right to negotiate. Do you see the link between their language and the culture care theory? We talked about that, the three care modes, the negotiation. That is the origin of everything that is transcultural nursing today. The culture care theory is the origin. Every single other theory that came afterwards was influenced and inspired by the culture care theory. That's why this theory is so important. Now you have also language that relates to cultural safety, which I explained earlier. And I want to urge all of you to visit tcns.org. I did include the link here. And to read their strategies for their human rights agenda. This is a really good resource for you. Now, the American Nursing Association has a code of ethics. What you may not know is that this past summer, they revised their code of ethics. This is brand new, literally like maybe 3-month old. They have now 10 provisions instead of 9. And I listed for you the provisions that have to do with culturally congruent care. One of them is the emphasis on dignity and respect or compassion. And basically this says that the nurse should practice with compassion and respect. And the second provision says the nurse's primary commitment is to the recipient of nursing care.
Dear Professor Hiba, yes. Just gentle reminder that 10 minutes left for your presentation.
10 minutes?
Yes, 10 minutes left.
I will do that. Thank you for letting me know. So I'm not going to go through all of them. They are available for you at the NNA website. But other challenges that we have today is that we have armed conflict and unrest around the world. We all know what's happening around the world. In Europe, in North America, there is a lot of anti-immigrant movement right now. And this combination of the armed conflict happening around the world and the anti-immigrant movement has resulted in a lot of migration of immigrants and migrants and refugees. And when you have this happening, often you have health disparities affecting these groups of people. This slide shows you what you're seeing in red is area where you do not have peace, where you have armed conflict. And you can see that this is happening across numerous areas around the world. And this is according to the United Nations 2025 report. This is how many people we have currently who are displaced. Again, think about what is happening in relation to health disparities. Other challenges we're encountering is that nursing faculty are finding themselves to be at increased risk of losing their jobs. In the United States, we've had nursing faculty who've lost their employments because they were advocating for the diversity, equity, inclusion, and belonging. They've actually were fired and lost their jobs. Right now, there are universities are struggling to remove language that specifically talk about diversity, equity, inclusion, and belonging if they want to survive. They're having to change the language. That's another challenge that we're facing. Academic freedom is being impacted. Free speech is being impacted. If you say anything outside of your work, you may get fired from your work. These are real issues that are happening today. And you also have the issues with the executive orders. Executive orders are government type orders. Like before, it used to be we would pay $5,000 to give a nurse H-2B1 visa to come and work. Now it's $100,000. How is this impacting nursing? They can't come to learn. They can't come to work. Who can come? Those who can afford golden visas. So that's also creating a shift in the dynamics at the global level. And we also have in the United States now a threat of stripping the citizenship of people who are born in the United States to parents who are not U.S. Citizens. So lots of challenges affecting grant money. Like they are no longer funding money that has to do with grants that support or promote culturally competent care or diversity, equity, and inclusion efforts. In education, we have other challenges, such as student perspectives about transcultural nursing, lack of faculty prepared in transcultural nursing, and the way transcultural nursing is incorporated in the curriculum. So as far as the student perspective about transcultural nursing, many students think that this is more theory, but they don't think how to apply it in clinical. Okay, and at the same time, as faculty are concerned, many faculty feel confident in their clinical practice, but not confident in the way they teach transcultural nursing in the classroom. There needs to be a way that links the theoretical learning to practical application, and this can be done through clinical simulations and other creative means. The faculty, if you look at within your own academic institutions, how many of your faculty have received formal training in transcultural nursing? We're not finding that many of the faculty have received formal training, and the reason also is that many of the programs that are solely dedicated to transcultural care are being eroded. They're disappearing. And why are they disappearing? Numerous factors. One is lack of interest. Two is currently the political environment. And so you have a vicious cycle. You want to teach the students, but you don't have faculty who is academically prepared, and you don't have programs that your faculty can use to get that formal academic preparation. So that's another issue. However, you do have now certification programs available for your practitioners, for the nurses out there, as well as for faculty. The Transcultural Nursing Society offers certification, and currently we have 250 nurses who are certified. And currently the society is looking at reviewing the certification process. Another issue that we are dealing with is many of the programs around the world utilize NCLEX as a benchmark for students, especially if they are planning to travel and work in the United States. And NCLEX preparation is the focus of students. They do not care about transcultural content. They care about passing the NCLEX exam. The teachers and the universities are focusing on having the students pass the NCLEX exam, and they are not looking at, even within the NCLEX exam itself, the only cultural content is listed under psychosocial integrity and safe and effective care environment categories. And if you look at the AACN essentials, they no longer have cultural competence. They replaced it with DEI. And now DEI is going to be replaced again. So going back to this slide, what do? What the evidence base shows is that you need to have a transcultural course, standalone course. So basically one course at the beginning of your curriculum that teaches transcultural nursing, and then you need to incorporate transcultural nursing in the rest of the courses. And how can you do that? You need a consultant, and you need a faculty on board who has received formal training in transcultural nursing. And how do you do that? There are many efforts and initiatives to assist you with this. If you are a member of the European Transcultural Nursing Association, or if you are a member of the Transcultural Nursing Society, both of these societies provide you with numerous resources. You have annual conferences you can attend, you have newsletters, you have resources on their websites, you have the Journal of Transcultural Nursing from the Transcultural Nursing Society. They are now working on a transcultural nursing course. So if you have faculty interested, once this course becomes available, they can take it. They can bring the knowledge back and infuse it in your curriculum. The website also houses information about courses you can take outside of the organization. And you have lots of scholars who are publishing, and these are just pictures of some of the books. I'm going to scroll through them because they are available on the PowerPoint I'm leaving for you. And again, this is the newer edition. I want to point out that we have the president of the American Medical Association has contributed a chapter to that book as well. And all of these people are scholars and fellows who have contributed to that book. So these are national professional organizations that support culturally congruent care. You can look into them for resources, and they are all listed here for you, so you can take a look at them. You also have, these are global organizations that also house resources on their websites. And finally, I want to conclude by what can you do now? What is your turn? What can you do? I want to encourage all of you to become advocate for culturally congruent care. By including this in your curricula, by educating, and by seeking formal education yourselves and seeking certification, by presenting and publishing locally, nationally, and internationally about your endeavors, your work, your scholarship, and serving on professional university or school organizations, committees that support this work, and also attending conferences and networking with other people in the field. These are some terms that we want to encourage you to continue to use or to incorporate in your courses and in your everyday practice. This is a model that has not been published yet, so you can read it, but you cannot share it. And basically, we are advocating that culturally congruent movement can be facilitated through incorporation of accreditation standards, national standards that apply to your country, faculty and curricular support, interprofessional collaboration with others, workforce initiatives at your workplace, and experiential learning. That's the simulations, the clinical practice. And if you want to get certified, you can look at the Transcultural Nursing Society website. Anybody with a master's or postmaster's can seek an advanced specialist certification, whereas people with a diploma or associate or bachelor degree can seek the generalist basic certification. And this is a new model that we have not published yet. We're basically saying that culturally congruent care is best promoted and facilitated through an integration of numerous concepts such as cultural humility, safety, compassion, and cultural care theory, along with pursuit of lifelong cultural competence training. I wish I had time to do this. This is a model on how to create a culturally sensitive and welcoming academic environment. Basically, you do that through ongoing cultural assessment and evaluation involving everybody that you see in the circles, educational curricular adaptation and revision, ongoing cultural sensitivity training, and programmatic adaptation, accommodation, and revision. What do you need to change in your program, in your policies? How can you be more student-centered? And that's how you end up with a culturally welcoming and sensitive. And this one is coming up. There's a whole chapter in the new book about this that explains it. Finally, use the cultural care theory, incorporated. And finally, I want to ask you to reflect on what you are learning in this conference and ask yourself, what can you do now? Dr. Leininger wanted to have the cultural needs of the people in the whole world met by nurses prepared in transcultural nursing. We want to counteract this and say we want the healthcare needs of the people across the world to be met by an interdisciplinary group of healthcare providers prepared in collaborative and transformational healthcare. So thank you for listening. I know I kind of whizzed through the last part of the presentation in the last 10 minutes, but I want to now open it for questions.
Okay, thank you very much for Professor Hiba for your truly insightful and inspiring presentation. Okay, for the participant online, you can write in the chat box, but I already checked in the chat box, there is no question. Actually, I will give a chance to the participant on site. Please raise your hand and state your name and your institution. You can raise your hand and then, okay, Mrs. Rika.
So I have a question.
Yeah.
Can the PowerPoint
Actually, we will deliver the question directly from the on-site participant, Professor, because there is no question in the chat box. Yeah, please, Mrs. Rika Fatmadona.
Thank you so much. Good morning, Prof. Hiba. It's me, Rika again. I actually, currently I am studying about cultural care for Indonesian nurse in providing end-of-life care. So when, in my experience, when I ask them about transcultural care, they think that because they think that about the culture, oh, we just provide the nurse for Indonesian people only, not for native patients. So that they think that they just do not aware about the transcultural nursing. So that means that yes, we just provide the caring just like a common what we provide in daily. So what I take information about this, that I think that cultural care, not every nurse aware about this cultural care term, right, Ajahn, Prof. Because when I observe how they do provide end-of-life care, and they think that it's just like a common. They do not aware about that. So, but we see that there is an emic and also about ethic, right, Prof? The perspective of inside the nurse, yeah. And then me as outsiders, I see how they provide the care. So how make them aware that they need to provide the care, become aware about cultural care, because I saw in a sunrise model there is some cultural factors that maybe in Indonesia, in our country, we have also another factors that affect on how they provide the care. Like in Indonesia, we have a Muslim a lot. Meanwhile, maybe like in Thailand, they are Buddhist nurse a lot. Not major in Islam, in Muslim. So my question is how to make the nurse aware that they should pay attention of the patients with their culture. I think that's all. Thank you.
That's a very good question, and thank you for asking it. We need to provide, I would recommend that you approach is this a hospital?
Yes.
End-of-life care? Hospice?
Cancer, National Cancer Hospital. It's a big hospital.
So if you can approach the education department within the hospital and suggest that they engage in a series of cultural competence training. And here's what they would need to include in the training. We always recommend that they start with an exercise or an activity that encourages the nurses to engage in a self-assessment of their own values and beliefs and practices. And that can include their own religious or spiritual. Remember how I said not everybody is religious. Some people are Muslim, some people are Christians, some people are Buddhist, some people are atheist, agnostic. Some people are just identify themselves as spiritual but not religious, right? So an exercise in self-assessment, an exercise where they introduce them to numerous concepts. And we actually did a series of those trainings at Cleveland Hospital here in the United States. You want to do something interactive with your audience, so it helps the information sink in rather than just somebody talking to them. But you need to explain to them the culture care theory as well. You seem to have a good understanding of it. You may be a speaker yourself, Seriously, I mean, I can tell that you have really good understanding,
Yeah.
and not only that, but then you want to emphasize the importance of just like when they engaged in the self-assessment, they understood what is important to them. They need to make the link between, just like I have values that are important to me, others have values that are important to them. They may be different from mine, but I need to respect them regardless, and I need to work with them to accommodate their needs. And I need to maybe negotiate, maybe change, maybe restructure, maintain, preserve. These three care action modes need to be taught, and they need to understand how to link it into clinical practice.
Okay. Thank you so much.
But approach your department, see if they can provide educational training.
Yeah.
And then find the person who can provide the training.
Yeah, I also interest about transcultural certified nurse.
Certificate, yes.
Certificate
Yes.
nurse. So maybe I need a lot of information about that. Maybe can we get in your slide or maybe in other?
Yeah, tcns.org. Just go to the website of the society, tcns.org. They are currently also revising the process. Everything is being revamped. We have a new president who is a scholar and a fellow, and so she is. I mean, she's doing really good work with the board of trustees. They are revising, but if you have, like I said, there are two types of certification: basic and advanced. If you have a master or higher, you can get the advanced. If you have a BFN or a diploma, you get the basic.
Okay.
And all the instructions are on the website.
Okay, thank you so much, Professor. Maybe next, I heard that there is a transcultural community, and also every year or every 2 years there is a conference also about transcultural, right? Right, Professor?
Wonderful.
Wonderful.
Yeah.
Perhaps that we are from Indonesia can come together to join the conference.
It's actually a dream
Yeah.
of mine to. I'm actually thinking about when I want to retire. I want to retire in Indonesia. Which means I need to come one time before and visit.
Yes,
But it's a dream.
we
I
welcome
love
you.
your country.
Yes.
I honestly love your country, and I would love to someday come in person and do an immersion study there.
Yes, we are very, yeah.
Okay. Okay, thank
Thank
you,
you so
Mrs.
much,
Rika
thank you so much,
Fatmadana.
Professor.
And we have the one question in the chat box, Professor, from the participant online. That question is, my team and I have collected data or cultural competence. When we asked them about it, most of them were unaware of it. My question is, what intervention can be provided to nurse regarding culture-based nursing care, and what kind of assessment do you recommend so that culture can be implemented?
Yes, that's another very good question. And as I alluded to in the presentation, curricula need to include standalone courses at the beginning of the curriculum. And then you need to do mapping and thread cultural component in every single course. Any single course you are teaching can have cultural content. You link it to whatever theory you are providing or assessment or assignment you are asking the students to complete. Find a cultural component that you can link it to. So this is one. Second, so we talk about curricular revision is the first by a standalone course and then threading throughout the curriculum. Let me just, okay, so what type of interventions and exercises and assessments? Everybody needs to start with a self-assessment. That's always the first thing you do, self-assessment. And in the 2015 theory book, I have a chapter that includes, it's excellent for educators. It's literally, all of it is exercises and strategies, and it even includes a syllabus for a transcultural course. I have the whole syllabus shared. I think it's in the 2015 theory book. There's a chapter, and you don't have to buy it. You can just look at it through your library and see if you can find a digital copy and look at that chapter and possibly print it. But I have a chapter that comes with a syllabus in the electronic version, and it has a description of a lot of excellent exercises you can use with nurses in your class or in a clinic uh, to help them understand the concept. I have a stereotype activity class, and a self-assessment is called Know Thyself that I use religiously in my courses. And I have several other exercises, and like I said, a whole syllabus shared with you. So hopefully that will be helpful. Again, it's the 2015 theory book.
Okay, Professor, there is a very good idea that we think that we will start to write the Indonesian version, maybe, Professor, in the future. It will be help for the practitioner and educator in the future. Okay, Professor, since the time constraint, on behalf of the organizing committee, we certainly thank you, Professor Hiba, for sharing your expertise and time with us today. Your lecture is truly enriched our understanding how culturally competent and sustainable healthcare can address global health challenges in the future. We can conclude this lecture that very important for us as an academy and then practitioner to increase our competency. That important thing we have to seek and find and get the certificate like the basic and advanced transcultural nursing certificate, and we also can access the website and then many media that inform about the transcultural nursing. Okay, once again, thank you, Professor Hiba. Good evening in Michigan. Please give big applause for Professor Hiba. Okay, to all the participants, please stay tuned for our next plenary session. Thank you very much and enjoy the rest of the conference. I'll hand it back to the master ceremony. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Alama, for those essential insights on cultural competence and sustainability in healthcare. And thank you, Mrs. Lenny, for moderating. And next, as a token of appreciation for our speaker who joined us online today, we will proceed with a symbolic certificate presentation to Professor Alama. So thank you, Professor, for your time and for your sharing with all participants at this 5th Andalas International Nursing Conference 2025. And we wish you a good continue for your activities, Professor Alama. And next, we will move forward to session 3. But before we move forward to session 3, for those all of you who does not take the coffee breaks, may take the coffee breaks, and we continue to the session 3. And is it a pleasure to welcome Associate Professor Dr. Kamsunapat Baltip from Prince Songkhla University, Thailand. Dr. Baltip will be speaking on the strengthening healthcare system through collaborative community partnerships, and these sessions will be moderated and managed by Muhammad Hendra Setia Leswana, SCAP and SMSc PhD. And ladies and gentlemen, we are pleased to introduce our moderators for these sessions, Muhammad Hendra Setia Leswana, SCAP and SMSc PhD. Dr. Leswana is a distinguished lecturer and researcher in departments of mental health and community And this session will be led by the committee. And please welcome NS Windy Fresca MCAP.
Boleh applause? Okay, thank you. MC Akbar ya. Okay. All right, everyone. Before we continue to the next session, let's have a short and fun break to refresh our mind. Are you still excited for this session? Okay. We play a simple and exacting game called Guess the Famous Figure. Okay. I will show you some picture of famous people from around the world. Okay. And your job is to guess who they are. Okay? But listen carefully to the rules. For each picture, I will give you 2 clues. And please wait until I finish giving both clues. Okay? Don't shout the answer yet. After the 2 clues are done, if you think you know the answer, raise your hand. Okay? And the committee will choose who get the answer first. Okay? Please pay attention to look the participant. Okay. I think it's fair. Okay, let's play. Clue number 1. Next. Okay, she is known as the founder of modern nursing. Wait, until clues number 2. Okay. The clues number 2 is she was called the lady with the lamb. Okay. Okay. 1, 2, 3. Actually, yes, okay. Give the mic to the participant this side. Okay.
Thank you. I'm very excited with your
maybe
games.
you can introduce yourself first.
Okay.
Where you come from?
Thank you,
After
Bu
that, the
Windy.
answer.
My name is Dwi Novrianda,
Okay.
and I guess she is Florence Nightingale.
Okay, let's the answer. I'm sorry. Yes, Florence Nightingale. Okay, committee? Right, okay. Thank you. Okay, next one. Listen. He called the king of pop. The clue number 2 is he made the moonwalk who were famous to the moon itself. Okay, count down, please. 1, 2, no, 3. Yeah, okay. Boleh, in the middle.
Thank you.
Okay.
Michael Jackson.
Okay. Yeah, Michael Jackson. Okay, let's move on to the third. Okay, clue number 1. He's the leader from Indonesia with a military background. Okay. Clue number 2. He's currently serving as the president of Indonesia. Okay, I think. Okay.
Thank you.
Be patient ya.
Presiden Prabowo Subianto.
Okay. Okay, now let's see if we have. Oh my God, I have participant on Zoom. I don't see in Zoom. How about Zoom? How about in Zoom? Yeah, we cannot give the prize to participant on Zoom, right? Okay. Now let's see if we have some K-pop fans here. Yeah? Who is that? She is a superstar from South Korea. Clue number 2. She's famous for her rap, her fashion, and the like Blackpink in your area. Okay. 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 I think it's, start countdown again. 1, 2, 3. Okay. Please commit it. Okay.
Jenny Kim Blackpink.
Okay. Let's see the answer. Jenny Blackpink. Yeah. Okay. Last question. And it is very special, right? The clue number 1 is he's not just famous. He is one of our speakers in the conference. Clue number 2 is the handsome guy, right? And he's one of GBI director. Countdown again. Okay. 1, 2, 3. I think it's cameraman. Okay. Sorry, from India. Okay.
Professor Craig.
Can you say the full name?
Professor Craig Lockwood.
Okay, let's see the answer. Yeah, Professor Craig Lockwood from Australia, Adelaide. Okay. Okay, bonus. This is the last question. The clue is, yeah. The clue is, who is CEO from KRU in Andalas University? No boy here. Okay, countdown. 1, 2, 3. Yeah. Okay. Student. Okay. Who's the answer?
The CEO of Carrier Indonesian is Mrs. Leni Medawati.
Okay. Okay, thank you. Okay, I think it's enough, and then we'll be continued to the next section. Okay. I close to Assalamualaikum warahmatullahi wabarakatuh.
All right, ladies and gentlemen, that's the ice breaking for the committee. I hope you guys don't be sad that doesn't get the gift, but we will have another sessions maybe later that committees will prepare for us. All right, ladies and gentlemen, right now we present our final plenary speakers for our conference. Professor Nelwati SKP MN PhD from Universitas Andalas Indonesia. Professor Nelwati will share her expertise on peer learning as a pathway to building professional competence in nursing. And these sessions will be moderated and managed by Dr. NSW Novrianda SKP MK. And allow me to introduce our moderator, Dr. N.S. Dwi Novrianda S.Cap M.Cap, a dedicated lectures in Departments of Child and Maternity Nursing at the Faculty of Nursing, Universitas Andalas. Dr. Novrianda holds a doctoral degree in pediatric nursing from Universitas Gadjah Mada and is a leading expert in evidence-based practice for children, with a focus on symptom management in pediatric cancers. Notably, she is a developer of Chemo Assist for Children's mobile health applications, reflecting her significant commitment to integrating digital health technology and research to improve care outcome for children and their families. Ladies and gentlemen, please join me in welcoming Dr. Rino Friandas to the stage.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen, distinguished guests, and all participants of the 5th Andalas International Nursing Conference. Welcome to session 3, our plenary session. My name is Dwi Novrianda, and I have the pleasure of serving as the moderator for this session. In this session, we are honored to have with us an outstanding speaker who will share her insights on a topic that is highly relevant to our conference theme. Please allow me to introduce Professor Nelwati, MN PhD. She is a professor of basic nursing at the Faculty of Nursing, Universitas Andalas, Indonesia. Prof. Nelwati has an extensive background in professional values and competencies, peer learning, and also nursing professionalism, and has published numerous works that have contributed significantly to nursing knowledge and global practice. Today, she will deliver a presentation entitled Peer Learning as a Pathway to Building Professional Competence in Nursing. Ladies and gentlemen, please join me in welcoming Prof. Nelwati.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. It's still morning, right? First of all, let us praise and thank to Allah Subhanahu wa Ta'ala who has given us His mercy and grace today, and we convey also a prayer and blessing to our Prophet Muhammad Sallallahu Alaihi Wasallam. Today, I'm so honorable to be here in front of you, and I say thank you for the committee, INIC committee that has invited me to talking in this conference, and thank you for the all participants has joining in this session. Let me begin this session with asking you a simple question. Have you ever learned something more deeply without reading textbook or attending the lecture, but it comes from the explaining from your classmates or from your college. Have you even learned more deeply without that? Yes or no? Yes. If your answer yes, it means that you have learned, experience the power of peer learning. So today I would like to share about the peer learning as a pathway to building professional competence in nursing. Today, we are diving into the topic of peer learning as a pathway to building professional competence in nursing because the topic is becoming popular and vital in nursing education. This topic will cover what we can do, what we can arrange and manage to develop professional competence among the nursing students. Because we are the professional nurses, so the institution, the educational institution, have the responsibility to prepare their students to become a professional and competent nurses by providing the innovative strategy, the innovative learning strategy to build the professional competence. The professional competence and professional values should develop since the student at year 1. This competence developed during the professional practice and during their learning process in the sorry, little bit tremor. Okay. We are, as the professional education institution, take the responsibility to prepare the student become a professional nurse that can exhibit professional competence and professional values during their daily nursing practice. This competence should develop during the professional nurse education, which can start at year 1 as the students and keep continue during performing nursing profession. The development of health science and technology in health has led to an increased need for excellent healthcare. It is challenging for nursing to remain as distinctive health professional to provide holistic care for the patient in a safe and a quality and a good quality. Therefore, nurses are required to gain and demonstrate professional competence. By having professional competence, it enables the nurses to integrate evidence-based knowledge, advanced technical skill, critical thinking, cultural sensitivity, and digital literacy into their practice. Professional competence in nursing is not a static achievement, but a dynamic process of growth and refinement, cultivated through formal education, clinical experience, reflection, and continuous professional development. It encompasses both the tangible aspect of practice, such as technical skill and clinical decision-making, and the intangible qualities of empathy, ethical judgment, and leadership. Thus, fostering and assessing professional competence is central to nursing education and practice. As professional nurse program institution, we must support learning process in preparing competent and professional nurses. We can arrange and manage the effective strategy how this can be achieved by the students. As an adult learner, we can emphasize that the student to learn actively and independently, as it can nurture professionalism, develop student capacity, and foster lifelong learning. Active participation in the learning process can allow the student to learn from and with their peer, that well known as peer learning. Peer learning has increasingly been recognized as an effective educational strategy in nursing education, particularly as a pathway to developing professional competence. Through collaborative learning, peer feedback, and shared problem solving, nursing students not only strengthen their clinical knowledge, but also strengthen the clinical communication, teamwork ability, and cultivate critical thinking. Unlike traditional teacher-centered method, this peer learning fosters active achievement, reflecting practice and mutual responsibility. So what I'm going to share today with you is to address peer learning as a pathway to building professional competence in nursing. As we can see on the slide that it is the outline the presentation today. The firstly is what is the peer learning. You can identify what the definition of the peer learning, and the next is how the peer learning works. We can identify the theoretical framework for peer learning. After that, the format of peer learning can also discuss, and we can determine the strategy how to manage and arrange the type of peer learning. We should also recognize what the impact of peer learning that have been proven through rigorous studies. We have to design the peer learning properly in order to achieve the learning outcome and notice the challenging of peer learning. Last but not least, I will share you the lesson learned from Faculty of Nursing, Universitas Andalas, by sharing a study that I have conducted to fulfill my doctoral study. So let's start with the first topic. What is the peer learning in nursing? Peer learning in nursing can be defined as educational strategy where students learn from and with other. The learners at similar level interact to communicate, to act both formally and informally, to develop knowledge, clinical competencies, and professional skill. It involves students working in pair or group in classroom, working in laboratory, and in clinical setting to practice skill and share the knowledge. Peer learning offers a powerful educational approach for strengthening professional competence in nursing by actively engaging students in reciprocal knowledge exchange, feedback, and collaborative problem solving. So it is the definition of the peer learning. Now let's move to the theoretical framework of peer learning. How the peer learning works. Social learning theory, or SLT by Bandura, is one of theoretical framework for peer learning. SLT focus on the learning that occurring within social context and consider how people learn from one and to another. SLT also emphasizes the importance of observation and modeling others. Learning process takes place through observation, imitation, and modeling that regulated by 4 principles of process, that namely attention process, retention process, motor reproduction, and motivational process. This is the 4 principles of social learning theory that proposed by Bandura. The 4 principles of learning process can be described as follows. The first process is attention process. It is the process that requires someone to attend or recognize something to be learned, and the person should focus on the task. Then retention process, it means that the obtained knowledge needs to be retained by internalizing information and recalling it later in similar situation. In the third principle is the reproduction process, or that involve prior knowledge to be repeated and practice to improve it through a mental and physical rehearsal. Finally, the motivational process is required to perform behavior or skills that could be reinforcement from feedback. This is the theoretical framework what used to develop peer learning program in my study that will be discussed in the next section. Yes, that is lesson learned from the Faculty of Nursing, Universitas Andalas. After we discuss the theoretical framework for developing peer learning program, this is the format, the format of peer learning, how we can design and manage the learning process to achieve the learning outcome. There are some formats that can we use that have been developed and implemented that form from previous study. Peer tutoring or peer-assisted learning has found and be used to one learner or small group instruct another to a specific task or skill. And another format is reciprocal peer learning or teaching, which is the small group each take responsibility for part of a topic and teach others. Or we can pair the students share responsibility for group of patients in a clinical setting with less direct oversight from preceptor. It known by student-led clinical placement. And another format is peer mentoring or near-peer support that more experienced students mentor junior across academic, social, or well-being domains. Ladies and gentlemen, from literature, from the empirical literature, there are some benefit or the impact of peer learning. The first one is peer learning can enhance learning and skill. Students get hand-on clinical skill, improve clinical thinking, and boost problem solving and decision-making abilities through this peer learning. Teaching peer also reinforce the knowledge of the tutor, and peer learning provide opportunity for nursing students to practice and articulate clinical procedure with one another. When students explain concept, demonstrate skill, or correct peer mistake, they deepen their own understanding through the learning by teaching effect. For example, practice physical assessment, medication calculation, or patient education in peer group help the student to consolidate technical skill in a safe and low-stress environment before they apply them into the real patient. This process strengthens the clinical competence that has been a core domain of professional competence. The other benefit of peer learning is it can increase self-confidence and reduce anxiety. Working with peer can provide emotional support and reassurance, helping to reduce the anxiety and stress often associated with initial practice. Improving teamwork and communication is perceived as benefit of peer learning also. The collaborative nature of peer learning strengthens communication skill and foster a sense of teamwork, which are critical for professional nursing. Professional competence in nursing require effective communication not only with patient but also with colleagues. Peer learning also provides a structured platform to practice listening, expressing idea clearly, negotiating, and providing feedback. These skills are essential for interprofessional collaboration in clinical practice. By working closely with peer students and learn how to handle conflict constructively. Peer learning has also been proven to develop critical thinking and clinical judgment. Through peer discussion, case study analysis, and collaborative problem solving, students also challenge to justify decision, evaluate alternative, and reflect an outcome. This dynamic exchange encourages clinical thinking and evidence-based decision making. The next benefit of peer learning is building leadership skill. When students take on roles such as peer mentors, facilitator, or group leader, they practice essential leadership skill, including delegating tasks, motivating peer, or guiding group learning. The next benefit of peer learning is reinforce professional identity and caring. Both mentor and mentees gain a stronger sense of professional identity and commitment to nursing value by participating in peer support and collaborative learning. Engaging in peer learning encourage students to demonstrate mutual respect, empathy, and accountability in their practice. The another benefit is supporting lifelong learning and reflective practice. As we know that professional competence is not a static process, so it requires continuous development. Peer learning encourages students to engage in self-assessment, reflection, and constructive feedback. That is the impact or benefit of peer learning. By considering the benefit this method, we can motivate us to arrange and manage peer learning in nursing. At the end, can produce professional and competent nurse. So, how to design the peer learning? Because the correct design of peer learning, it can assure us to achieve the outcome. There is some design what we should pay attention. The first is we need to formalize the program to ensure clear objective and alignment to the curriculum. It means that formalize peer learning program and mentorship scheme to ensure consistency and clear expectation. Another one is we need to provide training and prepare the student how to act as effective peer tutor, peer mentor, and peer educator, such as by providing training and pedagogy, how to provide feedback, and how to use rubric to improve the quality of peer instruction and peer assessment. What should we do to ensure peer learning can work properly? So we need to ensure that faculty support play a facilitative and supervisory role, setting the expectation. And the important thing one is we need to integrate with curriculum, link peer learning activity to the course syllabus and learning outcome. For example, we can arrange in particular courses that containing technical skill use peer learning activities. Each student will be involved in reciprocal peer learning and have responsibilities to teach others to achieve the course learning objective. We realize that the innovative strategy in learning can provide challenges and considerations that should we identify and solve it. The challenges and the consideration which be potential for learning incorrect information. There is a potential for learning incorrect information or inaccurate knowledge as variability in knowledge and skill level of the student that can lead to unequal learning opportunities. Less experienced peer tutor may teach incorrect information if not properly trained or supervised. A lack of content expertise in the peer group can hinder the effective learning. The other challenges is the time constraint and workload pressure. As we know that nursing curricula sometimes often intensive, leaving limited time for the student to participate in this program. Even the program should be integrated to the curriculum. And another challenge is the inconsistent application and student preference for independent work, and the emotional and psychological challenge would be challenges for implementing this learning strategy. So we have examined the peer learning that offers some benefit and innovate, and as a peer innovative learning strategy. So embarking from this, I'm interested to explore further, and so delighted to share with you what have been done in this topic. Please allow me to present. The first step that I did to explore more this method is by conducting a systematic review, a qualitative study that exploring peer learning experience of undergraduate nursing students. This work has been published in Nurse Education Today in 2018. This study was conducted to identify and synthesize qualitative evidence of peer learning experience to understand perception. A qualitative systematic review conducted in accordance with the enhancing transparency in reporting the synthesis of qualitative research. Six qualitative studies were included, and appraising using critical appraisal scale program, and thematic analysis was used to analyze the data. The finding found that found two insights that emerging from this study, namely personal development and professional development. The first insight is personal development. This insight was integrated from the most common themes that, such as enhancing self-confidence, increasing communication skill, obtaining emotional support, and gaining socialization. The second insight that emerging from this study is professional development. It is integrated from the most common theme, which is building teamwork and leadership, enhancing cognitive skill, acquiring technical skill, and developing effective skill. From this systematic review, it suggested that peer learning enabled undergraduate nursing students to gain better skill and competence during their professional nursing education. through professional and personal development. Having well-organized program, both nursing educator and nurse student would gain positive impact from peer learning, particularly in developing professionalism. The effectiveness of peer learning or learning outcome development among nursing students should be explored. So, based on the finding of this systematic review, I developed peer learning program and implemented it to determine the effect of peer learning on professional values and professional competence among undergraduate nursing students. Ladies and gentlemen, this is the last session is about the lesson learned from Faculty of Nursing Universitas Andalas. I would like to share you a lesson how to develop, how to introduce, and how to implement peer learning program among undergraduate nursing students in clinical practice. This study is my doctoral thesis and had produced 3 articles in Q1 Scopus. The title of the study was The Effect of Peer Learning on Professional Value and Professional Competence Development among Indonesian Undergraduate Nursing Students. Attaining professional values and professional competence during professional nurse education program is necessary for the undergraduate nursing student in order to be able to deliver nursing care safely and effectively in their future workplace. Therefore, it is essential for us to initiate an alternative learning strategy in clinical practice. Peer learning could probably offer the benefit for the student because the students are placed in clinical area that require them to interact with others, making social interaction and working collaboratively in clinical practice. So the purpose of the study was to investigate the effectiveness of peer learning on professional value and professional competence development among Indonesian undergraduate nursing students during their professional clinical practice. This study employed a mixed method research using embedded design, a quasi-experimental study with non-equivalent control group, pre-test and post-test, and a qualitative study were chosen as the design of the study. 75 students completed the study with 37 students for the intervention and 38 for the control group. The students were selected using convenience sampling. To collect qualitative data, we selected using convenience sampling to collect. We've conduct 5 sessions of focus group discussion to collect qualitative data that selected purposefully from the participant in intervention group. Peer learning program was implemented for the first week of professional clinical practice in the clinical fundamental nursing, and the control group undertake or assigned to undertake clinical practice using conventional learning as usual. Tools that used to collect the data, we use the nurse professional value scale revised to measure the professional values, and the instrument of nurse professional competence to measure the professional competence. These both of tools have evaluated for its validity and reliability by conducting content validity, phase validity, and construct validity by conducting confirmatory factor analysis. To analyze the data, we use descriptive statistics, generalized linear model, and then structural equation modeling, and thematic analysis. To prepare the learning program, there are some steps they have conducted. The step 1 is preparation by searching and reviewing literature to provide the definition, benefit, technique, and strategy to implement peer learning. Based on literature, PLP or peer learning program was contracted and developed. And the second step is expert panel evaluation, meeting and discussing with the expert, which is the INIC representative of curriculum. Based on this meeting, the peer program was possible to implement it. The step 3 is the preparation, lesson plan, and learning material. And the last is workshop. One-day workshop for the student who will involve in intervention group had held in the campus, and the clinical preceptor was held in the hospital. This is the conceptual framework of the study. That based on social learning theory proposed by Bandura that I mentioned earlier, the 4 principles of learning process was used to develop and introduce peer learning program. Intervention during professional clinical practice is a peer learning program that intended to improve professional values and professional competence. Students who involved in the peer learning program would attend one-day workshop of peer learning prior taking professional clinical practice to attract the student attention. And during professional clinical practice, the student will perform peer role play and peer observation to retain the obtained knowledge. After that, the student provide feedback and had peer discussion to reinforce their peer performance by providing constructive and non-judgmental evaluation. The development of professional value and professional competence in Indonesia undergraduate nursing students were measured using NPVSR and NPC. This is the result of the quantitative study. Based on the quantitative data, we got that participants had stronger professional value orientation and higher professional competence following the educational intervention program of peer learning. Both the intervention and control group had significant difference in professional competence development, but not for the professional value development. There were no significant relationship between students' demography data and professional value and professional competence development. From qualitative data, there are 3 main themes emerging from this study, that is learning process of peer learning. The second is role of peer learning and barrier. The third is barrier of peer learning. That consists of 7 sub-themes, which is self-identification, knowledge sharing, developing professionalism, skill enhancement, clinical adjustment, resources availability, and establishing team. As the conclusion, peer learning is a holistic pathway for developing professional competence in nursing because it encompasses clinical expertise, critical thinking, communication, ethical value, leadership, and lifelong learning habit. So by embedding peer learning into both classroom and clinical education, nurse educator can create a supportive environment, not only equip students with technical skill, but also cultivate the value and reflective capacity that is essential for professional nursing practice. It has been not to discuss with you today. That is the end of my presentation. Thank you so much for the attention. Assalamualaikum warahmatullahi wabarakatuh.
Okay, thank you very much for Prof. Nawati for your enlightening and inspiring presentation. I think we have now deeper understanding about peer learning as one method or strategy of learning in nursing. So I think we will continue with a short question and answer session. For participants who are here on site, please raise your hand. For online participants, you may type your question on the chat box. Okay, I think we have participant want to asking the question in the right wing. Yeah. I hope the committee will bring the microphone.
So my name is Aurelia Sabrina. I am a nursing student at Faculty Nursing of Andalas University. So thanks for the material you said before. It is very insightful for me as a nursing student. Maybe I have some experience before for peer learning and do some project with my friends. So as you said earlier, there are many challenges for peer learning, right? I do try some experience for running a project with my friends, but we do have a problem. Of course, we have a varying level of engagement, of knowledge, and lead misperception. And so we have our thoughts. So maybe I think they are right, but my friends, it is not really solving the problem. So as a nursing student, what we can overcome, what you advise to resolve this problem of my own as a nursing student. So that's a question. Thank you.
Okay, thank you. That's a thoughtful question for Prof. Nawati. Okay, any question? More? Okay, on the back, at the back, Bu Emil.
Okay, thank you. My name is Emil. I'm from Faculty of Nursing, Andalas University. Firstly, I want to say thank you for the material presentation from Ms. Nelwati. And actually, this is not my question. I just want to share some experience. Previously, we adopt the peer learning strategy. However, we don't use it in professional state. We use it for only for practical laboratory learning, what we call it as peer tutor. In this activity, when the students go for laboratory activity in a group, like 12 to 15 students, and then each of the students will go will go as a peer tutor for their friends in that group. Based on our experience, the students said that this activity becomes more interesting, and I think that when they learn some technical activity from their friends, it must more interesting for them, and they use their vocabulary when doing some activities. That's yeah. They think that this is interesting. Even though we sometimes we face some problem in doing this technique. However, until now, we do not use any strategy to evaluate the outcome. So we only evaluate the outcome from the practical test and do not evaluate the outcome of how the students feel and think about this method. So we want to ask your opinion, how we can evaluate the outcome of this method based on your experience. Thank you.
Okay, I think we end to collect the question because we have 2 questions on site and 3 questions in the chat box. Okay, Prof. Nelwati, from Sabrina, she asked you about how to solve the challenges in peer learning method, and from the Bu Emil, she asked you about how we can evaluate the method. And in the chat box, we have 3 questions from Siska Mayangsari. She asked you about, based on your research and your suggestion, how do you envision the development of clinical learning methods in the next 5 to 10 years, particularly in response to the challenges of globalization and digitalization? What aspects need improvement or enhancement, and what new innovations might be necessary? And the second question from Martina Pakpahan, she asked you about the limitation of your study when choosing peer learning as a pathway to building professional competence in nursing. And the last from Ibu Rika Sabri, she asked you about how to use peer-to-peer learning methods in professional education, particularly in achieving community nursing competencies. I hope you can elaborate this question. The time is for you.
Thank you for the question. It is interesting question actually. For the first one is from Odelia, how to overcome the challenges of peer learning. Based on your experience, you said that you find the difference or different answer with between you and your friends, right? Actually, it is the challenge for us using peer learning. As I mentioned before, that there is a potential to give the less information, but from the guiding or supervise for your facilitator, it should be provide you the right answer for the obstacle that you found. So the role of the supervisor or facilitator of your courses have to supervise which one the correct answer of your problem. So when you found or face the differences between your friends, let's check together from the references or ask your facilitator actually. So the role of the facilitator should guide you to overcome this problem. Is it okay? The answer your question? Okay. From the Miss Emil about the how to evaluate the peer learning. Is this interesting, right? The peer learning as you implemented provide the student provide the interesting in this learning method. As we found that the peer learning can enhance clinical skill and can improve the self-confidence of the student, and therefore this kind of learning strategy can reduce the anxiety when they should face with the lecture. So to evaluate the peer learning, we have to, I think we have to state in the syllabus how you evaluate this peer learning activity in your group of laboratory practice, for example. We can develop the rubric of activity, which how to identify, how to assess which one the component or domain of what domain that you can assess. You can develop the rubric to evaluate the process of peer learning. So you, based on the experience of the fundamental nursing, we provide the rubric how the student my colleague develop the rubric how the student can conduct this peer learning activity, and how to develop based on their performance. We can evaluate with domain what you should assess. Does that answer the question? Yeah, thank you. For the online question from the Miss Siska Mayangsari. Hello Siska, how are you? It is alumni of the Faculty of Nursing, right? Yeah, it is. So the question is how to adapt with the digital, globalization and digitalization. Actually, the peer learning is supported by the digitalization and globalization. How come I can say like that? Because the student can search the information from the search engine, and they can articulate with their peers to develop the answer of the question that they set from the courses. The digitalization make it easier for the student to seek the information through the online platform. I think in the next 2 years, next 5 to 10 years, the using of peer learning can be more popular. That we can adopt in the Gen Z, and the development of digital technology era can provide us with the much information available online. I think is the answer. For the next question is, what is the limitation of your study in choosing peer learning as a pathway to building professional competence? There are some limitations that actually is the number of sample in this study is not quite large, so we need to improve the number of respondents, and because it's the self-instrument reported, sometimes it can be biased. The student or the participant would overrate their competence or their value using the Likert scale. So we should anticipate it, the self-reported instrument in this study. So I have a knowledge that the self-reported instrument should pay carefully. And the last question is how to use peer-to-peer learning method in professional education. How to use? I think I have this present in the slide. We need to make the structure or formalize the peer learning. It should be integrated to the curriculum or should be integrated in the courses syllabus. Because when we do not assess or do not give the mark for the peer learning activities in the courses, I think the student will not participate actively. So we need to acknowledge that these peer activities during the course will be assessed for how many percent in the total of mark yet you will get in the final mark for the courses. I think we can use the peer learning by integrating in the curriculum or by integrating and stated explicitly in the courses syllabus. Okay, maybe the answer. Thank you.
Okay, thank you, Prof. Newati, for your comprehensive response. We have any time, committee? We still have time? 5 minutes. Okay, 5 minutes more. If you have any question, because this topic, I think it's really interesting. As a nurse educator, we need to apply this method to enhance or to strengthen our student become a professional nurse. Okay, I think this is the last question from our participant. Please, the committee, for the microphone.
Baiklah, Assalamualaikum warahmatullahi wabarakatuh. My name is Putri. To Miss Nel, I am very impressed with this study you conducted. However, there are a few things that concern me regarding the effectiveness of the peer learning process, especially when related to Gen Z, who generally tend to be unmotivated for certain reasons, but also competitive. Did such issue appear in your study? Did such as dominant personality overshadow quit peers? And how do you address the problem of potential misinformation? It is my question. Thanks.
Okay, thank you. I think you can get the idea of the question. Or maybe you can repeat again the question.
My question, did such issue appear in your study? Did such as dominant personalities overshadow quitter peers? And how do you address the problem of potential misinformation?
Okay, I think the question is about how to handle the dominant personality in this peer learning method and how to solve this problem.
It's an interesting question. We realize that each person have a different personality, right? Sometimes the dominant personality can dominate the group peer discussion, for example. I think from the empirical literature, I found that the peer learning also provide us to respect each other. So we learn not to be dominant, not to use the what we call it, emotional for something, insist the idea into your group, the result of your discussion, for example. So I think the dominant personality should what we call press the domination in the discussion or the peer discussion. So we have to respect each other. By we can also give feedback, peer feedback, not provide the judgmental evaluation, because the process, the learning process should run smoothly, and the peer feedback that provide by your peers should non-judgmental evaluation or non-judgmental assessment evaluation. So we need to respect each other. Okay.
Okay, I think we have done for the question and answer question. I can conclude that from the talk of Prof. Nelwati and also from the question from the participant, it is important to increase the role of supervisor or facilitator roles to solve the problem during the peer learning method. So the student as the peer learner can achieve the value and competencies during the course. And also the supervisor should be arrange the syllabi or modules that can as a rule to do the peer learning method. Okay, ladies and gentlemen, that concludes our plenary session with Prof. Nelwati. On behalf of the organizing committee, we express our sincere gratitude for your valuable time, insight, and contribution to this conference, Prof. Nelwati. Please give a big round of applause once again for Prof. Nelwati. Okay, we will now take a short break before the next session. Thank you everyone for your attention and participation. I am Dwi Novrianda and it's been a pleasure to moderate this session. And I give him back to our Master of Ceremony. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you to Professor Nelwati for that crucial discussions and professional development, and also our moderator, Dr. Dwi Novrianda, to moderate these sessions. All right, ladies and gentlemen, before we move to our break, we have the certificate sessions given by the Vice Deans of the Faculty of Nursing of Universitas Andalas to our speakers and moderators. And we invite our speakers and also moderators to come up to in front of the stage. First is Associate Professor Dr. Kamsunapat Baltip, and the next Professor Nelwati SKP MN PhD, and also the moderator NS Leni Medrawati MK PhD, Muhammad Hendra Setiawan Lesmana SKP NS MSc PhD, and also NS Dwi Novrianda MK to come up to the in front of the stage. And the certificate will be given by the Vice Dean One of the Faculty of Nursing of Universitas Andalas. We would like to invite the Vice Dean One of the Faculty of Nursing Universitas Andalas, Dr. NS Ati Rahayuningsi SKP MKAP SPKAP, to come forward in front of the stage. Alright, first we'll give the certificate and plaques to Associate Professor Dr. Kamsunapat Baltip. All right, next to our speakers, Professor Nelwati SKP MN PhD. All right, next to our moderator, Mr. Muhammad Hendra Setia Lesmana SCAP NS MSc PhD. Okay, and the last one for Mrs. NS Dwi Novrianda MCAP. All right, next group photo sessions with all speakers and also the moderators with the Vice Dean 1 of Faculty of Nursing Universitas Andalas. All right, thank you so much. All right, we have our moderator, to our Vice Dean 1 to keep out in front of the stage. All right, let's give our moderator certificate to Mrs. N.S. Leni Medrawati SCAP PhD. All right, thank you so much to moderators and Vice Dean 1 of Faculty of Nursing of Universitas Andalas. Ladies and gentlemen, that concludes our plenary sessions of INIC 2025. And it's now time for the lunch break. And we will come back again in these rooms and also for the symposium sessions in 1:30 p.m. And ladies and gentlemen, please enjoy your lunch break. Thank you.